Hello, good evening. I'm Grace Osanana. Welcome to my channel once again. So today I want to talk about assessments in mental health OSCE. Please, this is a disclaimer that I'm not a mental health tutor, but I'm doing this from the experience I've gained. So what is needed in assessment? When you have the marking criteria, you see what and what is needed. So first, you have to assess the safety of your environment. Make sure the environment that you have is safe for you and your patients for the assessment to be conducted. Then ensure that you provide privacy for your patients. Then seek your patient's consent before going on with the assessment. Then you have to decontaminate your hands according to the 7 steps of hand hygiene. I did that earlier before now in my last video. So after contaminating your hand according to the 7 steps of hand hygiene, um, ensure that you tell the patients about your coming. Like tell the patients why you are there, what kind of assessment you want to carry out on the patient. Then you carry out. This thing is done. You that is the person assessing the patient and then your patient. So two people are involved. The examiner is there listening to you to whatever you are going to say, and the examiner will be scoring you. So what else? You also have to ensure that you sit in solar position. You have to sit comfortably at an angle, a comfortable angle and distance. You have to be use an open posture, not crossing your hand or your leg. You have to sit straight, lean forward from time to time, use eye contact effectively, and remain relaxed throughout the conversation. Then another thing is that before you start, you check to know if you're with the right patient. Ask the patient for their name, ask for their GP's name if they're in the community, then ask for their date of birth. But if they're in the hospital, you ask for their name, their date of birth, and their hospital number. Sometimes they might not be able to call out their hospital number because it's a long digit. You need to confirm it with the ID band. So when you are there when they're there in the hospital and you want to assess them, you can confirm with their ID band, their identification, their means of identification, and also confirming your documents what you are having. But if they're in the community, since they don't have this identification band, you have to check with your documents to know what they are telling you. Then their names and their GP's name and their date of birth tallies with the documents that you have. Then the next thing is asking the patient for their allergies. If they're allergic to anything, they'll inform you. If they're in the hospital, they will have an ID band with them to uh, know that they have allergies. But if they are in the community, they certainly will not have ID band, allergic band rather. So you have to use open-ended question to question them. Make sure you ask them about the risks. Make sure you ask them about their self-care and adherence to medication. Then certainly if there is risk to the patient, they should be admitted in the hospital. So the assessment, mental health OSCE assessment, takes 20 minutes to complete. So when you are given your paper to start your assessment, you should not rush into the assessment. You have 20 minutes to make sure you put your points together. So here, here is the assessment overview. So they'll give you something like this. And then you'll also have this, which has to do with the overview of recent history, the patient's history. So you'll be given something like that too. So you have to go through it, go through the patient assessment overview, and also go through the overview of recent history. Don't just rush into it. So in assessment, it has to do with the the nurse that assesses the patient and then the patient. It takes two people to do the assessment. But today I just want to do it by myself because I don't have an actor that will act as a patient for me. So they say the candidate briefing. It says you are a community mental health nurse and have received a referral for James John. And James John is known to mental health service and has a diagnosis of bipolar disorder. His mom has raised concern regarding the son's deterioration in mental health. So he said the son's deterioration in mental states rather. He said, please conduct a holistic mental health assessment using the recovery models of care areas below and including self-care and adherence to prescribed medication. You will be required to complete the patient's health questionnaire, PHQ-9, with James John and calculate the score and refer to the scoring outcome table for the results. So this is a case of depression and it has a PHQ-9. So what do you have to do when when you're given this question, first you need to assess the safety of your environment. Oh, I assess the safety of my environment. My environment is safe for I and my patients. I provide privacy by covering the curtain, maybe the window blinds, and I'll decontaminate my hands according to the 7 steps of hand hygiene. Then I'll read my scenario. You read your scenario. So when you read your scenario, you can be jotting down notes. You can make notes. So what is good in this assessment is that whatever problem that you have identified during assessment is what you will use to plan the care for the patient during the planning station. So whatever problem the patient has, make sure you bring a solution to it involving the patient to make the patient agree to the solution to the problem. Example, maybe the patient is not eating well, maybe skips food for like 3 days. You can ask, oh, is this how you were always eating before now? The patient might say no. So what has been your normal? How have you been eating before now? Oh, I eat twice a day, or I eat 3 times a day. So what kind of food do you like eating? The patient will mention the kind of food, or rice, crepes, chips, and you will have to ask, okay, so why are you not eating? What makes you not to eat now? If it's a patient that is depressed, might tell you, oh, I don't have energy to prepare food, I don't do this. You can ask, okay, would you want the support of your mom? If the patient is staying with the mom, would you want the support of your mom, or would you want us to involve any other person, or would you want a ready-made food to be ordered for you so that it will help you to eat? The patient might say, yes, I want those things. Then the patient has agreed to that. That means you have solved that problem. So that is that. And in this assessment, they're presenting complaints in the overview of recent history. They're presenting complaints that past medical history, social history, drug history, and allergies. Like presenting complaint, they say the patient has been staying in bed and doesn't have any energy. He has not stepped out of the house for around 4 weeks. His girlfriend of 3 years has left him as she is unable to cope with his moodiness. So he was also informed about the death of his grandmother, who raised him after his parents got divorced. Then he has not been able to go to work for the past 4 weeks. Then the mother found him unkempt. He has lost weight, and the house has not been cleaned, and he remains in bed since the time throughout. So the past medical history is that he had bipolar disorder. Then the social history, the girlfriend has broken up with him. No, he doesn't have a child. He moved into his grandmother's home when he was 5. He's non-smoker. He drinks alcohol occasionally, and he does not take illicit substances. The father had bipolar disorder, and then he's working as a postman in Royal Mail. Then his medications, drug history, he's on sodium valproate 500 milligram twice daily, paroxetine 220 milligram once daily, metformin 500. Okay, let's take that one out. Then his allergies, he has anaphylaxis. So it reacts to codeine, which it results in anaphylaxis. So here are the headings that you can use to ask the patient the questions: mood, relationship, major life events, living situation, patient self-care, non-adherence to medication, current rates, additional notes. So when you read your scenario, you make notes here on this heading. You use that 5 minutes to make notes here on this heading. So when you come, you ask the patient, oh, uh, hello, James, how are you? He will say, oh, I'm fine. Oh, I'm not fine. Please, I am the community mental health nurse that have come that is asked by your GP to come and assess you today. Are you okay? Are you okay if I go on with this assessment? He will say yes. So, oh, okay. Before now, you had already done the identification, asked of the name, the date of birth, the GP's name, and then you've gotten the consent. So you start, oh, in your own words, can you tell me what has been happening to you lately? And the patient can say, oh, I've been low in mood. I've not been eating for days now. I'm always on bed. I've not been able to go to work. My girlfriend left me because I'm always moody. She left me because of my moodiness. And I also heard that my grandmother that raised me has passed. And That is what has been going on with me. So mood, a patient has already talked about his mood. The patient is always low in mood. Then you go on to relationship. And James, so who has been supporting you so far among your relatives? Oh, my mother has been of a good support to me. She has been helping out, but I know she's tired because she's already aging. All right, thank you. So I've seen that you have a pre-filled PHQ-9 here. So we'll calculate the score and we'll arrive at the provisional diagnosis. So this is the PHQ-9. So we have a score of 21. So the provisional diagnosis for the score of 21, this is greater than 20, is major depression severe. So the treatment modalities or the treatment recommendation is antidepressants and psychotherapy, especially if not improved on monotherapy. So what do you have to do now? You ask, oh, this is your provisional diagnosis and this is your treatment recommendation. Are you on any antidepressants? The patient will tell you, yes, I'm on antidepressants. Say, okay, which of the antidepressants are you taking currently? He will tell you, okay, I'm on sodium valproate 500 milligrams twice daily and paroxetine 20 milligram once daily. You say, okay, how have you been taking your medications? The patient can tell you, oh, I've not been complying to my medication because I think it's making me more moody. It's making me to lack more energy. You can ask, have you talked to your GP about it? He might say no, have not talked to him about it. Then you can encourage you and say, oh, would you love to talk to your GP, inform your GP about your medication so that there will be a review on your medication. And if there are any changes, he will let you know. You can say yes, he will say yes, then that one has been solved. So you then go on to ask about major life events. So can you tell me, is there any major life events that has happened currently that you think might affect your mental health? The patient might tell you, oh, it's because of the death of my grandmom that raised me. So you can ask, okay, for the treatment recommendation, we talked about antidepressants, and the next thing is psychotherapy. You can ask, have you ever had any psychotherapy section? You can say, oh, I had it some time ago. So you can ask, how was it? Did you enjoy it? Was there positive effect from the psychotherapy? He will say yes or no. Say, oh, would you want to try psychotherapy again? You might say yes. Okay, if that's the case, I'll inform your GP so that a psychotherapy session can be scheduled for you. That one is that. So you come to the major life events. Oh, the death of your grandma. How did it affect you? He said, oh, my grandma was so much attached to her because she raised me, she nursed me. So her death has been very devastating. I don't know how to handle it. And I think it's one of the things that made me to go into depression. You can say, okay, if that's the case, have you had any psychotherapy session because of this major life events? You might say no. You can suggest, okay, if you have a psychotherapy section, let you it will help you to talk about whatever is worrying you with a psychotherapist, and then which will help you to cope better. Would you want to try to talk about it with a psychotherapist? You might say yes, then you know that one is solved. Then living situation, you ask, how is your work? And I say, oh, I'm not able to go to work for the past 4 weeks. You say, okay, have you been able to talk to your boss about this? You might say no or yes. Or you can inform your boss about your health so that maybe they will give you a sick leave so that when you are fit, you can go back to work. Then sleep, patient self-care. It asked about sleep. How are you sleeping? Are you able to sleep well, or you are sleeping longer than normal? Oh, I'm sleeping longer than normal. I'm always on bed. I don't have the energy to wake up. I don't have the energy to do anything. You can ask, okay, well, have you talked to your GP about it? Might say no, I've not. You're okay. I think your medications also might help you to improve your mood so that you'll be more active. So you I will advise that you adhere to your medication, or you talk to your GP about your medication. Then eating. How are you eating? I say, oh, I don't even have the appetite to eat. Okay, would you want to be referred to the dietitian so that he will help to plan your meals? He said, yes. Okay, that one is done. What of your showering? Are you able to shower well? No, I've not been having my shower. You can tell the patient, okay, there are benefits of showering. It will refresh you. It will make you lively. You'll be more active, and you present nicely. When last did you have a shower? Might say 3 days ago. You say, okay. Like, would you want to have a shower today? I say yes or no. Like, okay, would you want okay, before now, how have you been showering? He might say, oh, I've been showering once a day. So what were you doing at that time that enabled you to shower once a day? Might say nothing because I go to work, I shower. Okay, would you want to set alarm that will prompt you at times, maybe in the morning or in the afternoon, that you can shower? You might say yes or no. So you know that you have tackled that. Then you talk about current risks. Do you have any risks, any thoughts of harming yourself or others? Might say no, I don't have thoughts of harming myself. But if the patient says yes, I have thoughts of harming myself. Another thing is that those people with depression, they are always at risk of harming themselves. So you have to suggest for hospital admission for the patient. So after this, going through all this, you now tell the patient, you summarize everything from the mood and everything, then thank the patient and inform the patient that everything that has been said here, you will communicate back to the GP and then he will be informed. So that is that. You do your and the contamination again, and then you go. So that is that about assessment in depressive patients. Thank you.